My name is Narayana Subramaniam, and today my talk is going to be on the anatomy of listening. So, 2 years ago, I met a woman who had lost her voice, not metaphorically, but physically. There was a tongue cancer that had involved half of her tongue and had restricted its movement, and with it went the sound of her identity. So, as I sat in front of her, she put a piece of paper in front of me, and on it was written, "Doctor, will I ever be heard again?" So as a surgeon, it's very easy for us to think of surgery in a mechanical fashion as something we do just like any other trade, like being a plumber or an electrician. But as surgeons, very often we have to deal with the organs that make us human. And in order to do that, to restore function, we have to stop and listen. So machines listen constantly around us. Our phones are always listening. We have smart speakers, we have hospital dictation systems, and all of these pay perfect attention to us. So there's no fatigue, there's no bias, there's no judgment. As someone who uses technology in the healthcare space, it amazes me what technology is able to do. It's able to detect small pauses in the way we speak, subtle changes in our voice, pick up problems that humans struggle to do. But what does surprise me a little bit is how easy we trust the technology. The thing about technology is it's not necessarily programmed to care about us. It doesn't feel and there's no empathy. How many of us have put our medical symptoms into a Google or a Chat GPT? Show of hands? Good number. So the thing is, we are able to do this. We are able to put our deepest and darkest secret in. We are able to do this without any hesitation. We share these symptoms. Now, what keeps me up at night is the fact that sometimes machines listen better than human beings. So they pick up on our distress better than friends or family. And the idea of technology is not necessarily to replace humanity, but to amplify it. So the question isn't what happens when machines listen. The question is what happens when humans don't. So we are in the loudest era in human history. I don't think volume is the problem. The problem is sometimes we confuse noise for connection. We photograph our food when the person sitting opposite us is watching quietly. We text each other when we're in the same room. We send hearts to stories. We send applause without connecting. And we pass each other physically, but we don't interact. We keep scrolling at our phones even when we're having a conversation. Our eyes are down, our bodies are present, but our minds are elsewhere. Unfortunately, we fall into the same patterns when we're with patients in the clinic as well. So we're constantly listening for answers that we already expect. We're not listening for that patient's truth. So we do listen through the filter of experience. We're looking for patterns, we're looking for familiar symptoms to fit a diagnosis that we've already mentally made. We steer the conversation towards confirming it, rather than curiosity. And the patients pick up on this. So they give us answers that we think that we want to hear. So the biggest danger in this interaction between a patient and a doctor is not ignorance, it's confidence. Because when you feel too sure, too early, you stop listening. And when you stop listening, you lose out on valuable information. So it's important that we keep listening to each other because the body has to always find a way to speak. What you know as a surgeon is very often the body whispers before it screams. It rarely announces disaster. It hints asking to be noticed. So a subtle change in voice, little noise in your breathing, a little bit of fatigue. So we need to pay attention when the screaming starts. Unfortunately, all of listening isn't equal. So we know that all voices are not heard even when they scream. So we know that women, we know that minorities, rural patients, elderly patients, neurodivergent patients, often they struggle to be heard. Women are thought to be anxious. We think that they have low pain thresholds. The word hysteria comes from the Greek word for uterus. Minorities are thought to be less compliant and less informed, and very often we look for social explanations for their symptoms rather than biological ones. Rural patients, unfortunately, we confuse distance for ignorance. And when we look at the elderly, age is looked at as an explanation for everything. So a decline is expected. We rationalize discomfort, and confusion is just accepted as inevitable. Minds that work differently than ours, we expect to correct rather than understanding. So the reason why we listen this way is not necessarily because of cruelty, but because of the way that we are conditioned. I had a young lady who was complaining of throat pain, evaluated, finally turned out to be a cancer that everyone had missed. An elderly man who was fatigued for a long time, everyone thought it was an anemia, it was an underlying cancer. A young patient who was too young to have cancer, turned out that they weren't. So, in medicine, we call this diagnostic bias, but in plain and simple terms, it's called not being heard. So, what's the cost of that silence? We have a delayed diagnosis, we have an advanced disease, we have a loss of trust, and unfortunately, we have loss of lives. So, listening to each other is not soft, it's a part of survival. So, we need to slow down, we stay present with the other person, and try to understand their reality. The moment someone feels safe enough to share with us what really matters, those are the quiet moments where we can connect, understand, and acknowledge the story of the person in front of us. Maybe that's the point, right? So the loudest thing that we can actually do is to simply close our mouths and listen. So when voices are silenced for long enough, pain turns to whisper. So listening to pain very often is how we hear what society is ignored. It's the residue left when people are told, don't make a fuss. Your pain isn't actually that bad. Other people have it worse. We are often rushing patients through grief. We try and suppress their anger a little bit, and we tell them that discomfort is inconvenient for us to deal with. And then pain becomes the only possible way that they're heard. So my specialty demands a very particular kind of listening. So we're listening for a subtle wheeze when they breathe, which means that there could be a tumor in the airway. It could be a slight lisp that tells us that there's something wrong in the tongue. And it could be a slight cough when they have something to eat or drink that tells us that the patient's aspirating. But in my experience, the hardest part of listening is not listening to what patients say. It's listening to what they don't say. So fear rarely announces itself. Shame is often hidden behind a smile. And denial sits quietly behind statements like, it doesn't hurt that bad. So pain has many octaves and many of them are quiet. And to hear this, we need more than ears. We need a presence, the kind that stays when nothing is really being said, that doesn't rush to fix or explain, and it doesn't flinch. So beyond presence, it's important that we have that willingness to believe pain, even when there's no visible wounds, and to sit with it without running away, and to let it exist without any judgment. So as a surgeon, it's expected that you have all the answers and you're quite confident. But what you don't see is that very often we carry around a lot of noise too. So the noise of doubt before a high-risk surgery, the noise of replaying every little step after there's a surgical complication, and the noise of knowing that your hands may decide how the rest of someone else's life plays out. I remember one night after a difficult surgery, when I was sitting alone, the room was finally quiet. The surgery was over, the patient was stable. The world moves on, right? But you don't. So there are questions that keep echoing in your mind. And the biggest question is always, did I do enough? So as surgeons, we constantly have these doubts. It's not that we don't. It's not that they don't exist. But we are trained to keep moving by nature, and therefore we carry them quietly. And they shape us. So it makes you think, what we call intuition, which is that inner voice shaped by years of experience. Sometimes it's success, more often it's failure. Those costly lessons that are etched into muscle memory. So maybe intuition isn't necessarily a voice that we develop. Maybe it's our ability to listen to a voice that we hear despite the noise around us. So listening to ourselves is something that we have to do. It's not outwardly, it's something that we owe ourselves to do to get better. So we're all searching for not more certainty from one another, not necessarily louder answers, but moments where the noise finally softens. Countless scans, endless appointments, medications which no one can remember, but the side effects of which everyone remembers. And when it's all done, when it finally ends, treatment's over, you sit across from the patient and you ask them, what do you want now? What is it that you want? What is it that you need? So nobody ever says that they want more money, they want a promotion, they want more followers. The answers are quite simple. They want peace, they want time, they want to spend time with their children or their grandchildren, they want to speak again normally, they want to breathe around fear. And that's when you realize that healing isn't always about curing. Sometimes healing is quieter than that. It's the return of normalcy. So that ordinary thing that feels so common to all of us, the unnoticed rhythm of being alive. So breathing without having to think about it, talking without forcing yourself to be strong, sleeping without worry. So life slipping back into the background instead of demanding constant attention, fear and anxiety. So healing doesn't always announce itself. Sometimes it arrives just as quiet and it stays. So most people are uncomfortable with silence. They want constant explanations, they want some reassurance, and they feel like silence means that nothing's happening. But in medicine, silence is often where the most important things happen. Right before you tell someone that they have cancer, there's silence. Right after you tell them, there's silence. And in these moments, words really don't help much. Trying to fill that space with words doesn't really do much for your patient. What really important is not speaking too quickly, not moving on too fast, and staying present while their reality settles. That silence is not empty. It's giving people the time they need to process that information and understand what their life now looks like. So in head and neck cancer, the disease doesn't just change how our patients see the world, it changes how the world sees them. So when I tell somebody that they may need to lose their jaw, it needs to be reconstructed, or they may have to undergo removal of a voice box because it's involved by cancer, you're not just talking about surgery. You're asking them to imagine a future where they may not recognize themselves. For many patients, the fear isn't death, it's disfigurement, it's silence. It's the look on someone else's face when they walk into a room like this. Their idea of reconstruction after surgery is a misshapen face, large scars, a life lived in hiding. And I've had patients tell me, very quietly, I'd rather die than live like that. As doctors, it's our first instinct to think they don't know how far surgery has come, or they're being irrational. We want to save or prolong their lives. But this is where listening is very, very important. So what they're saying is not that they refuse treatment. They're telling you that they're afraid of losing who they are. And listening in that moment isn't about convincing them to undergo treatment, undergo surgery, or anything along those lines. It's about understanding what the patient wants, and you have to slow down and engage with them. So you introduce them to people who have already walked that same path. Be truthful to them without being patronizing, and acknowledge both the possibilities and the limits of what we can offer through our treatment. So remember something deeply human. However tired you are, however overstretched, burnt out you feel, the conversation that you're having with the patient opposite you is possibly the worst day of their life. So if you don't listen to them, you may save their life, but you may lose the person. So remember the patient from 2 years ago who wrote, "Doctor, will I ever be heard again?" So after months of surgery, reconstruction, rehabilitation, they returned to the clinic. This time no piece of paper, no expectation, no hesitation, just speech. So not loudly, not perfectly, but in their own voice. They said, "Thank you for listening to me, even when I couldn't speak. In a world that's overflowing with noise, where machines are listening constantly and people are not listening to each other often enough, your voice matters, your silence matters, and the greatest gift that we can offer one another in medicine, in community, and in life is simple. We listen. Thank you.